Hello flames. I'm here with my colleague, Dr. Rachel Rubin, who is a urologist and expert on sexual medicine. And we are talking today about the treatment and prevention of bladder issues and vaginal dryness. And we want to talk about vaginal estrogen and whether or not that's safe and whether we can feel comfortable as doctors prescribing it.
Hi everybody, I'm so happy to be here, and as many of you know, this is my favorite topic in the entire planet. So what I care most about in this world is what's called genital urinary syndrome of menopause. So genitals and urinary syndrome of menopause. And so after menopause, menopause never ends, by the way, it just is this gift that keeps on giving, right? So after around age 50, right, your body no longer produces estrogen, progesterone, and testosterone. And the genitals are so filled with hormone receptors. They need hormones to create a healthy and functioning microbiome, to create healthy tissue, to actually create an acidic environment so it can fight infection. And so as you get past menopause, your body is depleted of these hormones, and so the tissue dries out, it thins out, it becomes raw, it becomes irritated, and that equals symptoms. Yes, symptoms of pain with sex and vaginal dryness, but even worse, symptoms that affect your day-to-day life. Urinary frequency, urinary urgency, leakage, bladder pain, urinary tract infections, which can kill you. Every primary care doctor on earth gets phone call after phone call of, hey doc, I think I have a urinary tract infection. What if we prevent this
and what
problem?
do they get? They get antibiotics.
They get antibiotics,
over
which you get,
and
you
again.
get resistant infections, and you can end up very sick. The infection can go to your kidneys. You can go to the hospital. Grandma can die of a urinary tract infection. And so it is imperative that every primary care doctor on earth, every male primary care doctor, every female primary care doctor, every nurse practitioner, midwife, gynecologist, urologist, everyone understand that they can prescribe local hormones that are safe for everybody to use. And we'll talk about that. They're safe for everybody to use. Yes. They're very easy to do, but just like brushing your teeth, putting on deodorant, wearing your seatbelt, they are lifelong therapies in order to do what they are supposed to do. I can't say to you, well, I'm just done wearing my seatbelt because I've done it for so many years, so I think I'm protected. The bladder, the urethra, the vagina, the vulva require hormones to be strong and healthy and acidic to fight infection and to make sexual activity more comfortable if that's important to you. But it's not just about sex, it's about bladder and urinary health.
Yes.
And so it's very easy to do. My favorite way, which is not everybody's favorite way, but I think women don't love creams, and I think the creams are often done at too low of a dose for it to work. So we'll tell you how to do it with creams if that's what you choose to do. Very easy for every primary care doc. They make estradiol 10 microgram tablet inserts. It's a little 10 microgram tablet. The woman will put it in her vagina every day for 2 weeks, and then twice a week until death does she part. Twice a week until death does she part. So all she has to do is put a tablet in her vagina at bedtime. It dissolves by the time she wakes up. Easy, it's not messy, it's not goopy. Done till death does she part. Refill it forever, forever. You do not have to examine her vulva. You do not have to visually look, although you should, and we can teach you how to do that. You don't have to. It will take 2 to 3 months to work. You didn't build Rome in a day. It takes a long time to resurface the tissue. It's raw, it's thin, it's irritated.
And it's not considered systemic hormone therapy.
It is not hormone replacement therapy.
They don't have to be scared to make this prescription.
It is local hormone, so you can give it to 98-year-old grandma, and her estrogen level, which is going to be 0 when you start, is going to be 0 while she's on it. And
not
so
systemically absorbed.
It doesn't go through the whole body, so it doesn't cause problems. Now, the box says it does a lot of scary things. The box is based on all classes of hormone therapy. So if great grandma gets a birth control pill, guess what? Great grandma's gonna get blood clots.
Not good.
We
not
don't
good.
give great grandma a birth control pill. And so the way the box is labeled is based on hormones for the whole body, including estrogen and progestin and synthetic forms and oral whole body forms. It has nothing to do with the local vaginal products, which are totally safe, totally effective. I give to breast cancer patients all the time, and so you should talk to the oncologist and call them, but we've got guidelines behind us which say that, and there's no data on earth to show harm, so it is all the data in the world to show benefit, because if you can prevent urinary tract infections, if you can stop a woman from needing antibiotic over antibiotic, and if you can get a woman who has comfort with wearing pants again,
Yes.
who can sit, who
Yes.
can wipe without pain.
Yes.
It is not vaginal dryness of, oh, it's a little dry, add some coconut oil. It
Right.
is vaginal dryness where you cannot walk. You do not go to hang out with your friends because you're going to urinate every 5 minutes. You can't finish a movie because you have urinary
Yes.
urgency. So it is so imperative that every primary care doctor know that they can easily write a prescription. Remember, vaginal estrogen, 10 micrograms every day for 2 weeks, then twice a week forever. If that's all that you learn, wonderful. You like creams? Use 1 gram. So take a whole gram, put it in the vaginal canal every day for 2 weeks, and then twice a week forever. If you want to get fancy, they make rings. They make an E-string that goes in the vagina for 3 months at a time. It's going to be generic in a few months, which is great. And that is just a local ring. You put it in for 3 months at a time. It's great for your patients with poor dexterity or dementia. I've saved lives of patients who needed narcotics because they couldn't sit. She had dementia. We put in an E-string. We saved her life. She got off narcotics. She had a quality of life that was invaluable to herself and her husband.
I think as family doctors or as primary doctors, we get a little scared, a little nervous. We may not have been trained well about menopause treatment and therapies, and we don't feel comfortable, or we're worried that we're going to cause some bad outcome for the patient. But I'm here with Dr. Rubin to tell you that we don't have to be scared.
You don't have to worry.
We can do this.
This needs to be prescribed from the emergency room, right? Woman comes in with an infection or a proposed infection. She can leave with antibiotics, but she should also leave with a vaginal estrogen prescription. And so they shouldn't need to wait 6 months for the gynecology visit to open up.
Right.
They do not need to see a gynecologist to be given vaginal hormones in menopause. As primary care doctors, you can do this.
We can do it.
You should do this.
We should do it.
DM me, follow me on social media, Dr. Rachel Rubin. I will teach you how to do it. I will give you the tools. I will give you the prescriptions and the confidence to know that you can do it. You can do it safely. You can do it effectively, and the guidelines are behind you.
The guidelines are behind us.
And the American Urologic Association is investing in guidelines in genitourinary syndrome of menopause, because it is not just a gynecology condition. It is a primary care condition.
Absolutely.
It is a urology condition, and it is a condition that affects all women over 50, all women. And it's not just dryness, it's frequency, urgency, burning, pain, urinary tract infections. And so we don't screen.
Correct.
I don't care if the patient's sexually active. This should be something everybody should
Absolutely.
use.
And who's the first line that they come to when they get the UTI? Family doctors. And who prescribes that first antibiotic? Family doctors. We can decrease the frequency of urinary tract infections. We can improve her vaginal health, and we don't have to wait to refer them to urology or to refer them to anyone else. We can do this ourselves. One small prescription, and we can change a woman's life.
And we love collaborating.
Yes.
We love this multidisciplinary care, because we can all do this, and we should all be taking care of women. And please, thank you for giving me this platform. And it's so good to talk to you all.
Follow Dr. Rachel Rubin on her website,
RachelRubinMD.com, and Facebook, Instagram, Twitter at Dr. Rachel Rubin.
and keep watching Feminine Flame MD, where we will bring you information on women's health and the safe use of vaginal estrogen and other hormone therapies. Thank you.